We agree?
Yeah.
Yes.
Okay, what are they?
Lateral epicondyle of the humerus.
For the
Axis.
so the axis is going to be at the lateral epicondyle of the humerus. Okay, where's the stationary arm?
Midline of humerus of the acromion process.
Good. So
Pointing
it's
towards
going to
the radius.
follow the midline of the humerus, and it's going to point to the lateral midline of the acromia. Okay. How about the stationary arm?
That's what you just
Radial.
called for.
Sorry, that's the moving arm. Thank you.
Still at the midline of the humerus. Midline of radius.
Good. Midline of the radius, going towards the radial styloid process.
Yeah.
So, my thing says lateral midline, but that seems, lateral midline seems.
It's just telling you to orient to like the left. So if you say midline, that midline.
Yeah, okay.
Midline.
Okay.
Oh, sorry, you're totally correct. Midline, like the midline could be anterior, posterior, medial,
Okay.
lateral. So they're saying the lateral
That makes sense.
surface to the midline. Okay, we good?
Mm-hmm.
Yeah.
Okay. Were you taping that part? Because it totally
It's okay.
just touched her. Okay.
I can
so
cut it out.
Yeah, delete that part. That was terrible. So we're good there. All right. If somebody has smaller arms, like lengthwise, then this is where it's actually going to be time for us to switch goniometers, because you can see that's about the full length of her arm. So if you have somebody that's shorter in the arm length, we're going to have to actually switch and use the smaller goni, okay? Because you don't want this thing like overlapping significantly over there. It's not technically like wrong in the sense of you should still be able to measure fairly well, but it gets kind of awkward for you because it just looks kind of ridiculous. Like, what's going on over there when you have the goni going? All right, so we're going to first find our little landmarks, because that's what we like to do. So we're going to find our landmarks first with our palpation. And so we come down, we find our lateral epicondyle. We're happy. We check ourselves to make sure that we're not past the joint, because that's supposed to be a part of the humerus, right? So if where we bend, if we're on this side of it, then we have whoopsied, all right? But we would never do that because we did such a great job learning how to palpate. So we're on our lateral epicondyle. We start there, and then we may want to go ahead and just do a little spot check to figure out where that acromion is going to be, okay? So posterior, anterior surface, making the middle right about there. All right, so I can make my little note to self. All right, so my first step is to always get her in 0. We want to make sure she's in supination, just to be in anatomic position. Okay, so when we're finding our 0, we're going to make sure she's in anatomic position here. That should make sense to you if you forget when you go to line up the goniometer. Because if she's rotated this way or all the way pronated, and you're trying to follow that radius and hit the radial styloid process, if it's over here, now your goni is going to be at a funky angle, right? So it can't be in the same plane. So just pay attention to that. Your goniometer is only going in one plane, so the position of the patient should only be in a single plane. So if you have to rotate the goni this way, like at a diagonal, you've probably messed up something. Okay.
That's the same position for the passive range of motion.
As far as the patient, yes,
Yeah.
right, that's where we're starting. Yep. And we talked about in passive range of motion, we could take her through the different movements,
Just to
and
use different
especially,
muscles.
yeah, just to try to make sure we keep the mobility through the pronators and supinators all at once.
Okay.
However, we also then went into pronation and supination separately, so you could potentially just save yourself time and say, I'm working on that as we go in and out.
Okay.
That way. But yes, so our starting position is going to be the same. We can go either way. Once we found our 0 for one, we've essentially found our 0 for the other, right? So when we line up here, I may want to grab some extra pieces. Can you reach that towel? It's right there. So we can grab whatever we need to kind of get our arm positioned where she's still comfortable, but we keep that 0 line. People that have hyperextension, like, you need to watch this, because you are going to have to build this up. And you're just gonna have to play the game a little bit to figure out, like, where is each piece supposed to be. Like, because sometimes it's not necessarily that you need more towels, you just need to move the towel. So don't, get used to practicing lining people up where you're not just trying to always add a towel. Oh, fail. She's a little tight. She keeps pulling back into that little. You can see her at rest. She pulls in a little bit, so it's just a little more work for you. Try to make sure that you keep her there. Now she's just helping me. I'll pretend I don't know that for the sake of this awesome video that's happening here. Okay, and actually that's pretty close. So her resting position is almost dead on. And there. So I mean, she's like within like half a degree, I'd say there. So that's her 0 position. Okay. So if we want to go into extension, I can take away this bit, and I can see if we have any extra extension. I might steal this one too. And build her up here. That way we've got good clearance if she has a little hyperextension. But I don't want it to be right on the tip of the joint, okay, because that's a little bit much. All right, so we remembered when we do our passive range of motion, we're gonna take her to the end of range. So I can give just a little bit of movement there, and then I wanna know that I'm through the passive range because I can bounce at the end on that infield. Okay, what's this infield supposed to be? Bony or hard, correct, good. And when we say that, what makes it a bony, hard infield?
Electronon process and the electronon process.
Woo! Man, my little army's getting stronger day by day. Look at that. Okay, so what I'm gonna do is I'm gonna give some stabilization back here at the anterior part of the humerus, because if I push down to try to get more elbow extension, all she does is pop up here. So I wanna block that and then push her into that motion, and that right there, she doesn't move very far. That's it. So I'd maybe give her a couple degrees into hyperextension, technically hyperextension. Okay, so a few degrees of extension there. All right, now this is the part where it gets trickier doing it by yourself, but remember in the practical, and even while you're practicing if somebody else is around, you can say, Chrissy, I want you to come put your hand here and hold for me. Okay, so you can either let me be the stabilizer or you can let me be the distal side. You just gotta tell me. And then make sure that you give me directions, because we're gonna pretend I'm the
It's like unlike the other one that will pop up if you let it go. Is that what you're saying?
Right,
Like if
right,
you take
correct,
that down pressure
correct,
off,
yeah,
that's
right,
gonna...
right. So when I let my pressure off, even though technically this part doesn't move, this part readjusted.
Right.
And so yeah, like we want to make sure we're there. Now, even if you let it off, you know, you can always reorient yourself and you'll be okay to come back over, find your landmark, and then we're gonna give a little pressure over the top. So you can get used to using one hand to kind of stabilize it and then give pressure. So most of the time, I don't want you guys to really do any of that. Yeah, that's 5 degrees. Don't want you guys to do anything where you're like holding it and taking it through the motion. So we don't, like when we do flexion, I don't want this. I want you to get them through the range and then line up your Goni and then practice. So we do that extension. If you're having to do it by yourself, you may have to cheat a little bit on that rule, okay? And get them there and then have it down and have it ready and then give her just that little bitty bit of extra, okay?
Okay.
That one may be one of the ones where you get to cheat a little bit. All right, it's probably, there's one other one that's not coming to my head right now. So that's that part. We're good with the extension. Okay, so then we got the same little landmarks. I don't have to build her up as much because I wanted to build her up to make sure I got through the end of a range and extension. But in flexion, that's not helping as much. So I actually don't want this to be very high because I want to try to keep that humerus in line. Otherwise, it gets awkward when you're trying to get this angle. It's easier for you to envision that being equal rather than if we built her way up to here, like then it gets funky with you trying to make sure you're on angle. So keep it pretty close to neutral as far as parallel to the bed. That should help you out a little with just trying to start visualizing. All right, so then we take her through her full range, and so we're gonna leave that hand supinated when we go through the full range. As I take her through passive range, I'm gonna control the wrist motion, but I'm not pushing through her wrist, I'm pushing through her forearm, okay? And that would be the end of a range. All right, somebody guess, who we got? Rebecca, you're guessing this time.
I think it's the full one.
That's not a number.
Oh, 0 to 150.
Okay, 0 to 150, so that would be 90. If we add half more, that's 135. So I think that's a pretty decent guess, huh? We're pretty happy with that. Okay, so got her at the end of her range there. We're gonna come back over, find our little lateral epicondyle, find our midpoint of our acromion, and then also keep that visual toward that radial styloid process. And I would say she's actually at 160. Good job, perfect,
Oh, wow.
Great job, good deal.